Yo, what is all of that dental plaque and dental tartar? That is pretty huge. Have you ever wondered if the existence of all of that dental plaque and dental tartar only really affect the gums and the teeth, or is dental plaque and dental tartar much more dangerous than this, meaning affecting the rest of the body? Is it linked with some other medical diseases that you're very lucky today? Because I'm going to elaborate a lot about these diseases today. I'm going to introduce these topics so you get an idea. First of all, with regard to dental plaque, I talk about it very often. Dental plaque, as you know, is this, we call it biofilm, consisting of bacteria, certain debris, and food remnants that get stuck on the teeth, mostly the gum line, but they can exist also on multiple levels on the tooth itself, meaning on the middle of the tooth, the gum line, or even sometimes covering the entire tooth in some videos. Okay, so that's for dental plaque. Now, if this dental plaque, which can be generally speaking removed with a brush or a floss, is not cleaned properly and in a timely manner, then it can become dental tartar. This is where it gets much worse. Okay, dental tartar is far more sticky and hard and requires professional cleaning. You may say, okay, you tell us this every single day. What about the medical diseases? And what you need to know is, like, what does dental tartar or dental plaque being on the gum line have anything to do with the rest of the body or with medical diseases? And what you need to know in this case is that when you look at tartar, it's located typically at the gum line or near the gums. Okay, already it's causing an inflammation, which can be chronic over a long period of time, can be acute, and that inflammation of the gums is called gingivitis. So we already have inflammation now. Gingivitis is in relation to the gums of the teeth. Okay, what is the door for entry to the rest of the body? Okay, here's the important point. Okay. The door of entry that's being opened when there's inflammation there is that these bacteria and inflammatory things in relation to inflammation will pass through the blood vessels there and microtraumas and small areas and small bloodstream entry points into the rest of the body, because the gums and the blood supply to the gums is linked with the rest of the body. It's not independent from everything else, right? So that is the bacterial entry from local, the mouth, to systemic, the rest of the body. You may think, whoa, that sounds very weird. Like, does that mean the bacteria now just got everywhere? That's not how we think about things right now. I'm gonna address a couple of things that to be taken into consideration. I'll keep it very simple so that the audience can benefit from this. Okay, so one thing is very important and may surprise you. It's called the two-way street, meaning it goes both ways, and that is, I would argue, the scientific evidence would argue periodontal disease and diabetes. I know this sounds maybe very surprising for you, but there are studies looking at periodontal disease and diabetes. Okay, right. So, and why do I say two-way street? Someone with poorly controlled diabetes, for example, when we do examination of the mouth, we will generally see problems in relation to the gums. Okay, chronic inflammation, gingivitis, periodontal disease, and all of these things, as their gums has a tendency to react more aggressively to the presence of teeth plaque or dental plaque. So that's why we talk about this. Okay, and let's get to the heart of the matter, and that is cardiovascular health. I know some of you may be thinking, okay, we need to stop there. Are you serious about the relationship between dental plaque, periodontal disease, and cardiovascular disease? And yes, I'm serious about it. There's also evidence looking at the relationship and research looking at the relationship between oral bacteria and cardiovascular disease. So this is quite serious. It's not just things for social media, and that is it. Okay, so these are two, I thought, very common ones that people need to look at. When I say common, I meant people perhaps can relate to and think about more easily. So we just mentioned these things. Then what are things that we actually need to take into consideration? What are actionable steps that we need to take into consideration if somebody is concerned in relation to these things, dental tartar and dental plaque? The first thing, it may sound cliche, but maintaining excellent oral hygiene. Maintaining excellent oral hygiene, mouth hygiene, through very simple things like brushing regularly, at least twice a day for 2 minutes each. I personally use a dental floss. There are people who also use a water floss, which I think is great in general. Of course, this is not medical advice. Please consult with your doctor. I'm just talking about things from an educational perspective in relation to oral health. So brushing, flossing, water floss is also really good. There are also people who have braces, may have difficulty or struggle in using a traditional like string floss. So there are water floss options. There are also options such as something called as an interdental brush, which is a kind of a brush designed to help clean in between the teeth. So these are just very simple oral hygiene things that people need to take into consideration. So it's very important to think and look at diseases, medical diseases in relation to oral health. A lot of people think about oral health, okay, gums, teeth, tongue, floor of the mouth, cheeks from the inside, and that's it. That's not it, okay? So the mouth itself is part of the rest of the human okay, the rest of the human body. It's part of the head and face, I know, but also connected with the rest of the body. You may have heard of terms like holistic dentists and stuff. I don't want to go far there, but you get an idea. So these are supposedly dentists who look at the teeth, the gums, and the rest of the body, which I think is very, very important. I don't think about the teeth and gums as something completely separate. Okay, what other things that we need to take into consideration? Regular visits with the dentist. As I said, once it does get to dental tartar, which is much harder, it's like this hardened, transformed dental plaque into dental tartar. This requires professional cleaning. Okay, so things can get a little bit not necessarily more complicated, but just requiring professional help. Okay, and the dentist, dental hygienist, periodontist, these are the ones that can help really identify and clean very well, hopefully, the dental plaque and dental tartar that is existing on the gum line and on the teeth itself. As I said about the dental tartar, it's very hard, very difficult actually not very difficult, it's nearly impossible to brush off with typical tooth brushes. So that's why it does require professional cleaning done by a trained person. Okay, with regard to prevention, as we said, is very, very important to take things into serious matters with regard to prevention and trying to prevent all of these problems from happening in the first place, better than having them happen in the future and then dealing with them. That's all for today. Dr. Mo, dentist, out. Thank you everyone for watching. Don't forget to like, share this with your friends. It's important for the YouTube to push this video. Okay, peace.